There we go. Good morning, everyone, and thank you very much for joining us for today's webinar, Wellbeing by Design, a Purpose-Driven Built Environment. My name is Shalika Sivathasan, and I am the Administrative Assistant in the Continuing Education Department at the OAA. We will begin today's webinar by acknowledging the land on which we are meeting and calling in from today. For millennia, the place we call Ontario has been inhabited by Indigenous peoples and nations who have been stewards of the land and who are deeply connected to its rich cultural and natural landscape. We would like to invite you in a moment of reflection. We would like to invite you in a moment of reflection to acknowledge our shared responsibility to address past and present injustices and provide space for Indigenous knowledge and worldviews to shape the architectural landscape of Turtle Island. Before we begin, I would like to share some important information to ensure an effective and professional webinar experience. Please be informed that this session is being recorded for quality and educational purposes. For accessibility, we provide automated closed captioning service available in multiple languages to accommodate the needs of our diverse audience. In order to maintain a stable internet connection, we have muted all participant microphones and disabled video feeds. Kindly note that the chat function has also been deactivated. However, we do highly encourage engagement through our Q&A window, which you will find at the bottom of your screen. Feel free to submit any questions you may have for our speaker there. These will be addressed in the designated question and answer period at the end of the presentation. For those seeking continuing education at learning hours, please note that attendance is crucial. A minimum of 80% attendance is required for these hours to be accredited to your OAA transcript. Please allow a few weeks for the processing and reporting of these hours. And lastly, please note that the presenter does not provide insurance, legal, or practice advice, and the OAA does not bear responsibility for errors or omissions in discussions during the webinar. And with that, I am excited to introduce our speaker for today's session. Please welcome Antonio Gómez-Palacio.
Thank you. Just double checking the audio here. I hear there's a little bit of feedback, so is this better? Can you hear me okay? Yes? Okay, awesome. Perfect. We're testing something here that I think is the first time the OAA has done it, which is actually to present in a bit of a room. So if anybody is in our Vancouver studio, we're in boardroom number 1, and please come and join us. But I'm really excited today to talk a little bit about our community wellbeing framework, and it's really coming in an understanding of how we as design professionals can make the link between what we do and meaningfully improving the well-being of communities and the environment that we all share. But I want to start with actually a photograph of my great-grandmother. And let me put that up here. Here we go. So this is my great-grandmother, and I share it for a number of reasons. One is, well, I think it's a lovely photograph, and she's beautiful. And this, in fact, is my grandmother, and this is my mom. All three of them lived in Mexico City, and my great-grandmother 100 years ago, and for several generations. But this is a photograph of Mexico City 100 years ago. So imagine what things were like that. It's actually a little bit more than 100 years ago. This is in 1919. This was in the middle of a pandemic, right? At that time, the things that we were worried about as a society were, of course, infectious diseases, and it was a moment in which critical aspects of health were at the forefront of all of us. This is what Toronto looked like 100 years ago. And at that time, same as in Mexico City, if anybody on this webinar would have perished, sorry to be a little bit gloom around all of these things, in all likelihood, the 10 top causes of death, all of them would have been infectious diseases. So essentially a bug that you picked up somewhere, tuberculosis or some other kind of a bug. Today, despite global pandemics and all of these other kinds of things, the 10 top causes of death are all chronic diseases. So things to do with the heart, with diabetes, with essentially our lifestyles, the types of choices that we make on a day-to-day basis that affect how we how our health unfolds. So the critical thing to think about here is we continue to plan our cities and respond to concepts of health on a far dated version of what constitutes our health. We're still planning as if the 10 top causes of death were all infectious diseases, instead of really focusing on aspects of lifestyles. So now if I simply focus on the causes of premature death, so this is people who have not lived a full life, but their demise comes earlier. It's kind of morbid to show these slides right now, but in any case, think about premature deaths. 60% of them all have to do with lifestyle. 60% of premature deaths all have to do with the choices that we make on any given day and the places where we live. Only 30% has to do with genetics and 10% has to do with healthcare. This is huge, right? We focus a lot of the conversation around healthcare, around what healthcare practitioners do, when 60% actually has to do with the choices that people make, and frankly, with the environments that we build and the environments where people inhabit. So keep on thinking about these elements. Couple of thoughts. One is now, where do we invest as a society for this? 96% of the entire healthcare budget goes to that 10%. Think of 96% of the money goes to something that has a 10% impact. 4%, and public health officials talk about them and nickname themselves the 4%ers. 4% of the budget actually goes to the preventative side, to those things that will contribute to diminishing or reducing and influencing the lifestyle behaviors that have a positive impact. If I show you these two apples and think about it, which of these two apples would you bite into? It's very clear. You know exactly which one. And why? Well, because we have millions of years of genetic disposition to inform us which of these two apples contributes to our health and well-being. But if I show you these two built environments, which is the one that contributes to our health and well-being? Well, you'd like to think it's probably the one on the left, and yet it's the one on the right that we're building all over the place. We're actually building cities of rotten apples. We're building cities that have a negative impact to the exact health that we're trying to promote. And why? Partially because genetically, this is a very recent thing for us. We're still trying to figure this out. As a society, as communities, as individuals, we're only scratching now the surface around understanding the types of environments that can really contribute to our health and well-being. So let's do a little bit about that. Of course, it's not just about ourselves, it's also about the entire planet, right? And I try to locate where we are. So more or less locate yourself on the planet, but this is where we are. So it's not just about the health of us as individuals, it's also how we are all connected. And we've by now passed, and this is within our lifespans, or maybe not everybody on this webinar, but certainly within my lifespan, we have surpassed the Earth's capacity to replenish the pressure that we put on the planet, right? We're now consuming and creating more damage on the planet than what the planet is able to heal itself. So the question of health and well-being is also one that has to do with the entire planet. And this, of course, is compounded by a huge increase in world population. And you can speculate if that's going to plateau or it's going to change or what's going to happen. But the reality is that the more people that are inhabiting these environments and their lifestyles are more consumptive, it's adding pressure to the whole equation. My first few slides, by the way, are totally apocalyptic. Later in the presentation, I'm going to kind of make my way out of that. But we've also now surpassed the place where the majority of the planet was rural to the place where the majority of the planet is urban, which means that this is a topic of cities. This is a conversation around how do we design and inhabit our cities. And clearly cities can be a huge part of the problem, but they can also be a huge part of the solution. And that's the invitation for us today. And I'll link to any indicator of your choosing in terms of health and well-being. I'm showing here childhood obesity, but there's many other social determinants of health that you may want to pick on. We are trending in the wrong direction, right? In small communities, medium-sized communities, larger scaled, but also different income brackets, we are seeing a significant increase in childhood obesity and a detriment in many other health indicators. This, of course, is not unrelated to the compounding economic pressures that families face, right? So we see the global cost of food and the pressure for food in many societies is also trending in the wrong direction. So clearly it has a direct impact on obesity and eating healthy. Same with congestion. Different environments, we're seeing an increase in congestion, and climate change is having, and you'll see this in a number of different fronts, and depending on what community you live in, you'll see an increase in floods or fires or extreme heat days. Every environment that we're inhabiting is seeing an increase in the extreme weather events and the direct impact of that on communities. Are you feeling down enough at this point? The impact of that is, of course, on the displacement of people and social polarization, right? Most world refugees today are not coming from wars. They're environmental refugees because they're being displaced because of some of those big events or to the impact that it has on agriculture and their ways of life. So there's this real sense at a global scale, of course, that the end is near, and something is increasing in pressure. And what are we going to do? Many people respond from a place of disempowerment and cognitive dissonance, right? We disassociate from ourselves from it. But there is hope. And one hope that I'll point at is that smoker on the left-hand side of the screen, because smoking is one area where we have actually been able to establish a very direct causal link between a behavior and a health outcome, right? And as soon as that was established, we were able, therefore, to orient resources, build public awareness campaigns, do all kinds of things. And yes, there's still people smoking and the likes, but they're not doing it without awareness. And in fact, the net numbers have decreased. The next version of smoking, of course, is sedentary behaviors, right? There's now an increased level of attention and awareness around the impact that sedentary behaviors has on all kinds of health outcomes, right? In particular around chronic diseases. Nevertheless, if the only aspect around health was sedentary behaviors, I wouldn't need to be doing all of this exercise, right? So this is the entry point, and now we start to see promotions and campaigns around doing exercise and getting kids to walk to school and doing all of these kinds of things. But we still need to talk about mental health and social well-being and many, many other aspects. Just to stay on the physical health for a little while longer, across the planet, we see over 500 million people any given year, their health decline simply as a direct outcome of sedentary behaviors. That's huge. If you put it in dollars, that's over $27 billion direct impact on healthcare. Think about 4%, the 4%ers. If we could orient even a fraction of that cash and those resources and those investments back into positively influencing some of those behaviors, we could have a huge impact on people's lives. In Canada alone, the cost of healthcare, providing healthcare, constitutes 40% of provincial budgets. And that continues to rise. Every year, every decade, that percentage has increased. So clearly, we have to think about things differently, and we have to kind of orient ourselves differently. Back to 100 years ago, 200 years ago, right? When cities and urban planning and architecture and design started to recognize that there was a connection between health and the way that we design cities. But remember, at that time, it was all about infectious diseases. So downtowns were seen as toxic and nauseous, and that's when the Green Garden movement and the flight to suburbs and all of these other kinds of things emerged. But also huge strategies around cleaning the water supply and strategies around, reducing the spread of cholera and all kinds of these other diseases. Today, still linking a little bit more around health and well-being, there's organizations like the United Nations that has created indicators around how can we understand this connection between health and the design of our human settlements. But they're still focusing on some basic needs and necessities, right? Access to clean water, access to sewer supplies, right? These kinds of things. And absolutely this is needed. But I'd venture to imagine that for many of the folks on this webinar, that's not the types of things that they might be dealing on a day-to-day basis, right? They're often dealing in environments where these table stakes have already kind of advanced a little bit. But it's the reality that still in Canada, there's many communities that are dealing with some of these very basic elements. And we do see, I happen to be in Vancouver today. This is the Vancouver Vital Signs Report. The city of Vancouver actually goes out and measures health indicators on a number of different fronts. And it's not just physical activity. Some of the cool things that they measure is they'll go out and measure volunteer rates or voting rates or sense of identity. And they actually will go and, like, with a clip chart, ask people like, okay, how's our sense of belonging doing? And people will, on a scale of 1 to 10, and they'll track things from there. And these are really, really important. But as architects, as designers, as city builders, it's hard for us to directly affect, say, rates of voting within a community, maybe very indirectly and the likes. So it is clear that we need some vehicle through which we, as a profession, can really orient much of our work in this instance. But ultimately, even if we simply track the interest and the mental connection between health and city building, and measured by the number of publications and articles, that is significantly increasing, right? So 20, 30, 40 years ago, we were rarely talking about these things. Today, it's being made everywhere, right? So the awareness is already an amazing thing. And as awful as the pandemic was, it's increased the level of conversation around mental health and all kinds of other things. And that is a positive outcome. But we still have and inhabit that cognitive dissonance. The problem is way bigger than what I can do, and therefore I'm not going to do anything, right? And we tend to ignore the things that seem too large or too unwieldy. So what I'm hoping to do today is unpack it a little bit, make it a little bit more accessible, and actually discover that all of us have the capacity to start putting a dent, start having a positive influence and pushing the dial in a positive way. Our profession is clearly not in the reactive space. If somebody's having a heart attack, I hope that 911 doesn't call an architect. They call a doctor, they call a paramedic, they call somebody who can deal with that. So it's not the instance of the heart attack. It's the 50, 60 years before the heart attack that we have an opportunity to do something of it, right? It's in that 4%. It's in that proactive space. That's really where we can start to have a huge influence on the health and well-being of communities and the planet. But you're asking at this point, how does this happen? How can I actually do anything from it? And that, in essence, was a space that we found ourselves as well, 8, 9 years ago. We went through the soul-searching enterprise that many people would do, which is why do we do this? What are we trying to do with our practice and the craft that we love, right? Designing built environments. What are we trying to do? And we came up with this statement, which is to meaningfully improve the well-being of communities and the environment. And we thought, super cool, that's great. But the next morning, we realized we have no idea what that means. Like, how do you actually understand well-being? How do you define community? Who participates? How do you know that you're making any positive impact? And we realized that we have some skills and a certain part of a widget in the conversation, but we needed to engage people who had many other skills and could bring their own intelligence to inform this conversation. So a big research process started, and we got a whole bunch of people engaged. The Conference Board of Canada was a leading figure in all of this, and all of the outcomes of what I'm going to talk about in a second have all been published by the Conference Board of Canada, and they're all available for anybody to download and use. But it was really important to think about it very broadly. So folks from Laval University, the Center for Research around Disabilities, and we had folks from mental health and Indigenous groups and people, accessibility, and very different groups to kind of come in and inform this exercise. And it started, as many research projects starts, with reading anything that anybody had ever published, so over 3,000 pieces of literature, and also talking to anybody who would talk to us. So city officials, chief medical officers, designers, city builders, professionals, people who could inform this conversation. And soon a picture started to clarify. But the first 6 months of all of this enterprise was simply trying to understand the problem, and if there was something out there that we could use as professionals. But we identified two key gaps in the whole landscape of knowledge in this area. One is, if you're a chief medical officer, there's tons of information around what you should do. If you're an architect, it's much harder, because I might tell you childhood obesity is not desirable. You architect, go and fix it. What are you going to do? You're going to Google something, check something, and maybe say, okay, walk to school. I'm going to try and create walking environments. And then how do you know that you're actually having an impact? You're not going to go and weigh kids afterwards. It's really hard for you to understand if you're having an impact or not. So it became very clear that we needed something that was going to be oriented around these professions: architecture, engineering, landscape architecture, urban planning, the design professions, and the city building professions. And then we needed something that was about bricks and mortar, not about measuring people. So we're not measuring individuals, we're actually informing the design of the built environment. So that's a huge shift in understanding how we host that conversation. The second big gap was scale. There's tons of information around health indicators and these things at a census tract level, right? So an entire community, or at an individual level, right? You can know information about yourself, or you can know information about a community. But how do you measure and understand the health of the people in one building, or the occupants of one park, or one neighborhood, right? So there's a big gap in how we collect data, but also in terms of the timeliness of that data, right? If I have to wait 5 years for the next census to unfold, it's not very useful. It's certainly not going to help me inform the choice between a couple of options. I needed to be able to collect the data in a more direct way, in a lively way. So recognizing that these were two big gaps. How can we as design professionals really guide our decision-making? And how can we also bring it to the scale at which we typically operate? The next step was now really understanding, what does community well-being mean? We spent 6 months just developing a different understanding of the definition. And we ended up adopting the definition that I'm putting on the screen, which is a definition that many other places have adopted. New Zealand uses this as their definition at a federal government level, and every initiative that comes to the federal government is actually tested against this, and it's become a definition that has more broad acception in many, many different areas. But I want to draw your attention to two aspects. And many of you would be quite acquainted with the triple bottom line of sustainability, right? Economic, environmental, social, sometimes they'll throw cultural in there. But you'll see in this definition the word political. And this is really important. And it doesn't mean political parties and these kinds of things. What it means is who is sitting around the table matters. Who's participating in the conversation matters. This is so important that it's actually emphasized in the second part of the definition. Individuals and communities need to be part of understanding how the health of their communities is defined and evolved and implemented. This was a huge watershed because whereas at a certain point, we might think that we can create guidelines for prescribed outcomes, what this means is we can't. There is nothing that you can define that is universally going to be applied across the entire planet. We're always going to need to tailor understandings. We're always going to have to participate with communities and develop solutions that are unique and bespoke and tailored to context and to individuals. So it meant that whereas we could have a set of standards, it really became a way of informing the conversation. So what I will be presenting in a minute is more questions to be asked through the process as opposed to outcomes to be achieved, because it's more about what you can bring into facilitating the conversation and then coming up with some solutions. And I'll give you some examples of how that actually plays out. So we were at a place where we had a definition, great. We have these 5 domains, right, that had an approach to understanding the areas of influence. The next stage was really start to honing in on indicators that would guide the conversation. And we had at a certain point an Excel sheet that had over 2,000 indicators that different pieces of literature were reviewing and the likes. But we honed it down to 18 indicators that are much closer to what we do and can really guide some of these conversations, and then tested them and refined them a little bit further. But think about them as the type of indicators that a health professional might track on yourself when you go in. Like they'll check your weight, your temperature, your number of different things. And then depending on if there's a red flag somewhere, they'll dig in a little deeper. So these are the 18 indicators. And around these, there's 52 different metrics that give a little bit more depth. And what I'll do now is walk us through the 18 indicators, which is really an invitation for your next project, the next thing that you're doing. Really think about these very carefully and have some of those conversations with your communities. So the first domain that I'll speak to is the social domain. And there's a number of things here that really allows us to host and facilitate that conversation. The first indicator is welcoming. Is an environment truly welcoming to people of all backgrounds, all ages, all participants in a community? Because if through this process, we're actually disenfranchising one group of the community, right? And if it's going to create barriers to access to a whole participant of the group, clearly we're not going to be contributing to the health and well-being of everybody. So ask yourselves right at the beginning of the project, not at the end, right at the beginning of the project, are we taking into account and creating environments that are truly welcoming to everybody? And that's not just the outcome, your entire process. Are we creating a table where people can participate and we can hear the voices of people that need to be part of this process? Remember, one of the domains is the political, right? Process matters. The second indicator here is support systems. Are we asking right at the beginning of the project, what are the support systems that this community, this group of tenants, this group of park users, what do they need in order to undertake the activities of their everyday life? And it's going to be different everywhere. This is why you can't have prescribed outcomes, because the support systems that people need are going to be different. The park users might say, hey, we need washrooms, right? A different community might say, we need childcare or access to healthy food or different things. And as an example, just on the healthy food, I saw one group, they were doing an office fit up for a little suburban building. And they asked, and the response was, well, there's nowhere here to get access to healthy food. So they decided to put in a couple of fridges and set up a little program where fresh fruit and vegetables were brought in. They found a way to solve that. But the only way they did that was because they asked the question right at the beginning, is what are the support systems that this group of people, this community needs? And again, don't ask about it at the end. It's right at the beginning. The third indicator here is socialization. And of course, we all know that socialization is a big part and a contributor to health, well-being, mental health, to building strong social networks that people have to be more resilient. But I had no idea to what extent. And some of you through the pandemic may have tested this a little bit further and realized how important it is. But it is actually phenomenal. We can push early onset dementia by about 9 years simply by having strong spaces of socialization. Reduce the suicidal rate with teenagers, has a huge impact on the resilience of communities if they're able to support each other. So again, if we now know that creating spaces of socialization has a huge impact on mental health and social well-being, why are we not asking this question at the beginning of the project? How are we going to create these environments in a true way? The second domain is the environmental domain. And I venture to imagine that many of you have focused on this on many of your projects, but I'll give you a couple of indicators to enrich this a little bit more. The first indicator that I'll speak to is delight and enjoyment. If we do not enjoy the environments in which we are, clearly it's not going to contribute to our mental health. So what are some of the metrics here? Well, access to natural light, access to natural ventilation, biophilia, views to nature, right? The Bayview Hospital in Toronto was able to demonstrate that there was a 30% faster recovery rate in the rooms that had the views to the valley, right? And to the Don Valley and the views to nature. Same doctors, same procedures, same everything. The only difference is biophilia, having that connection to nature. So having environments that people can truly feel that they're inhabiting in a positive way has a huge impact. And then, of course, all of the indicators that many of you would typically be measuring, right? The carbon, energy, quality of air, quality of light, quality of water, all of these other aspects. And we need to be thinking about those because the health of the planet, the health of the ecosystem services that we depend on is intricately tied to ourselves. A third indicator here is mobility, right? And this is often precisely the one that many of us have focused over the years. Reduced car dependency, increased active lifestyles. And those are the two that are focused on here. But if that was the only thing, I wouldn't need to do all of the other 17 indicators, right? Clearly extremely important, but very focused on reducing the impact to the environment of car dependency, increasing the health and well-being of individuals by active lifestyles. The fourth indicator here is resilience. And resilience is a word that gets tossed around a lot. And it's often used in the context of building or engineering your way out of some big catastrophic event. So how to prevent a flood, how to prevent these kinds of things. But I'll invite you to think about resilience not as preventing change, but rather as adapting to change, around our ability to weather change and be better at the other end and know who do we want to be at the other end. And I'll give you an example. Aging. I'd venture to imagine that everybody in this room, that everybody on the webinar is probably aging. How many of us are living in the spaces that are designed for us to age in place? It's change, it's happening. We know it's coming, but have we actually thought through the process of adapting to that change and then having the design of the environment that is going to be conducive for us to be resilient to the change that we know is coming, right? We tend to resist change, not come at it from a position of adapting and evolving. And there's many aspects of change. Yes, there's the big catastrophic things that are emerging, whether it's because of environment or geopolitics or all of these other things. But then there's also the long brewing stresses. Age, but changes in demographics, changes in technology, changes in the economy. We're constantly facing all of these changes. And how are we able to build some resilience as individuals, as families, as communities? So starting a process and a project and asking ourselves, what are the shocks and the stresses that any community is confronting? Who are the vulnerable people, the vulnerable communities to those shocks and stresses? What are our operational continuity objectives across the board? How are we going to adapt to these things? Is a critical question, but we need to be thinking about it more as an evolution than as a preventing change conversation. The third domain is the economic domain, and there's a couple of things here. The first one, of course, prominent in many people's minds is affordability. But we tend to focus the conversation a lot on the affordability of housing. And many of us will have very little impact on the price at which a unit goes out to the market, whether for rental or for sale, right? We have very little control on that. But we, in fact, have a huge role to play on creating affordability for households. Think about a couple of things. The average Canadian over their entire lifespan, so from cradle to grave, will spend 29% of all of their disposable income on housing. But they'll spend 19% of that income on their car. And they'll spend 11% of that income on their utilities and households, just keeping the lights on at home. So if I can create an environment that people don't need to own a car, and in a net zero home, I've just liberated the exact same amount that people need in order to pay for their home. We have the capacity to actually have a huge impact on affordable lifestyles. We need to be thinking about affordable transportation, about affordable access to recreation, access to affordable healthcare and healthy food. We need to be thinking about all those things that impact people's costs and lifestyle. And sometimes we'll have a direct impact on the housing, but we can make a huge impact if we have an incidence on many of the other aspects that influence a household's budget. The second indicator here is complete communities. And this is the idea that if I can do all of these things within walking distance, it can have a huge impact, right? If I can create those support systems and those spaces of socialization and those approach to affordability, all of these things within a walking space, I'm actually connecting the dots. And if distance matters, this next indicator, which is life cycle, time also matters. I need to be thinking about not just opening day, but what happened before? Where are materials sourced? Where did things come from? How are things manufactured? How are things assembled and pulled together? Who participated in the construction? But then also, how are things operated and maintained and decommissioned, and what's the next wave and the next cycle that happened around things, right? Christina, in the room, you participated in a project where the timeline was 1,000 years, right? And very clearly thinking about those environments that are going to be able to generate a thinking that is evolving and shifting all of the time. And the last indicator here is a local economy. And that means that if I spend $1, that dollar can now spin through the community a couple of times, it's going to have a very direct positive impact. So think about a couple of examples, right? If in the construction of something, I'm actually hiring local talent or hiring local artists, but I'm also generating opportunities for people to thrive. So think of a single mom trying to set up a home business. If she lives in a community where she needs to go out and spend $2,000, $3,000 to rent a little office space to start her business, she's going to fail. But if she can do that from home and she can live in a live-work environment and she can create those environments, I've just taken $3,000 off from her monthly cost of starting a business. We can have a huge impact on how people can have access to their livelihood and have access to forms of income and evolve as a local economy. The fourth indicator here is the cultural indicator, which is often forgotten in many of the conversations around the triple bottom line, but it's a hugely important one. The first indicator here is access to cultural and recreational vitality. And by this, I don't mean museums and galleries and sports venues. By this, I mean access to your culture. And I'll give you an example. I was standing in a university in Saskatchewan and with an Indigenous student. And he turns around and told me, I've lived in the city my entire life. And when I look around, I don't see anything that represents or speaks to my culture. Can you imagine what that does, that sense of alienation does to your mental health, to your sense of connection and well-being? We need to be thinking about how do people connect to culture? How do we learn about each other's cultures? How do we see ourselves represented? How do we participate in the different environments and truly be able to be part of those areas that we inhabit? And that's going to be critical to this next one, which is a sense of belonging. And you remember I told you the City of Vancouver's Vital Signs report goes out and actually asks people about sense of belonging. Some of the metrics here are, do you know your neighbors? Do you volunteer? We know that communities where there's a high rate of volunteerism are way more resilient. The social networks that they build are able to catch that senior whose health is, spiraling downwards through isolation and loneliness and other aspects. It's not the lifespan, but the health span that is significantly increased. And some health professionals are starting to measure this in a very direct way. And the US, for example, right now has a 12-year gap between lifespan and health span. That means 12 years people are significantly decreasing in health. We can make a big dent on these things by simply addressing some of these areas. And before, how many projects I worried about rates of volunteerism before? 0. But now, right at the very beginning of a project, I'll ask, so how are we going to create environments where people can engage and foster a sense of belonging? And it's amazing the types of things that you get when you ask a community. How are we going to create environments where people can participate? And they'll come up with community gardens and Canada Blooms and all kinds of different things. And some amazing stories. In the town of Petrolia, they developed a little program where the seniors who were isolated and couldn't get to the hospital, They connected them to the teenagers who were bored out of their minds so that the teenagers could volunteer and drive the seniors to the hospital. And they started to connect. And the isolation of the seniors and the disconnection of the teenagers started to break some of those barriers. But it only happened because they thought about it and because the seniors had no sidewalks, so they started to build sidewalks to connect back to the hospital. It was very much around having this conversation as a starting point. The fourth indicator here is play, and I love this one. And the literature is only increasing around how important it is for us to play in environments. And this is not just kids, this is all of us. And I think about play as our ability to act creatively in our environment. In simple things, like for example, fixed benches in a park versus movable benches. If any of you have been like 4 friends trying to sit down on a bench in a park, it's impossible. Like how do you sit? You can't even have a conversation. The environment becomes a barrier to our ability to socialize. Movable chairs in a park, instantly you're adapting, you're changing, you're starting to be creative around it. We can play. Our creativity is accepted in a huge part. We can design for environments of play. We can design for that creativity to unfold. The fourth indicator here is learning. And that's the notion that if people do not understand why we're doing all of this, then they're not going to adopt it, right? If I just go around wagging my finger and "Thou shalt lead active lifestyles," what are they going to do, right? But if they understand how it connects and they've been part of this process and they understand that this design has a reason, the likelihood of actually having a positive impact on behavior is going to be much, much greater. The final domain here is the political one. And yes, I love this photograph. We were doing public engagement at the ferry terminal in Toronto, and the Joker and Batman took some time to come and engage on our panels. The photos I'm not going to show is on the same day, a really hot day in the summer, and we were handing little glasses of lemonade. Turned out that this was the terminus of the naked bike ride, and they all came in and engaged with our panels as well, but this is a better photograph to show. So the first indicator on the political is an integrated process, right? Did we in fact have that diversity of voices participate through the process, right? Or did we have huge segments of society excluded from this? And there's some obvious people to bring in and who will participate, but sometimes we have to be a little bit more intentional around getting some voices heard, including voices that you will never hear, and things that we've done sometimes, and it can be a lot of fun, is baseball caps, and somebody takes on the voice of wildlife, or somebody takes on the voice of future generations. You'll never have them in the room, clearly, but how do we actually create a diversity of voices to enrich the conversation? Second indicator is collaboration. Just because they were there doesn't mean that they were able to participate meaningfully. So have we created a process that in fact allows for collaboration, that allows for all of us to learn something as we go through this exercise? You know, you hope to learn something about the community, but you also hope that the community learns something about health and well-being and why these things matter, and why just building more parking is not the solution to things, right? How we can start to think about these things differently. And this is really key, also the sense of belonging, to this last one, right? Which is a sense of stewardship and ownership. And think about this. In our penal system, right, in jails, we actually take away people's right to design their environments, right? They can't paint the walls, hang pictures, do all these kinds of things. You know, at your home, you'd like to think that you do that, except if you're a tenant in a building, right? And then those rights start to get curtailed and further curtailed. And now think about how we deal with our public environment. our parks. We don't allow people to actually make changes in the parks. We're treating many of our environments in our cities in the same way and disenfranchising people in the same way that we do in our penal system. That doesn't make sense. How do we actually create environments where people can have a sense of stewardship and a sense of ownership and really own those spaces? It has a huge impact, not just on the health of that space, but also on their own participation and their engagement and their mental health and the social connections that they establish. A lot here, eh? So at this point, you're probably thinking, how the hell am I going to do all of this, and how am I going to start to bring those into projects? There's like a little bit too much. Well, the easiest way to do it is just to do it, to start bringing it forward. I'll show you a couple of examples. This was in the city of Kingston. So we just asked, how are we going to create a sense of belonging? How are we going to create opportunities for volunteering? What would allow for a sense of stewardship? How do we create spaces of socialization? And people actually went and they came up with ideas for all those 18 different areas. And then what does that mean for the design of parks? What does it mean for the design of neighborhoods? What does it mean for the design of things? And the whole plan evolved and changed based on a very guided conversation around these questions. And we've all been in community meetings where you walk in and the only thing that people talk about is traffic and height and density, right? And for sure, you still need to do those. But what this is allowing is now a richer conversation where we can break it down and also talk about socialization and lifestyles and affordability and many other aspects that can connect some of those dots. This is in the city of Ottawa, and I love it because you had the local councillor there presenting the community well-being concepts and the likes. But you can see at the tables, people were actually using these on a day-to-day basis and helping inform the conversation. And as a consequence, the biggest affordable housing project in Ottawa's history, 1,050 affordable units, was adopted, but with integrated parks and connecting, and a really interesting project. But it was very much based on an integrated kind of a thinking. This one here in Vancouver, VCC, local college had 3 campuses, which has been built in a very insular way, big walls against the community. But the concept that emerged because of that completely flipped itself on its head and started to create an environment that was truly open and engaging with the community, and not just because they wanted to have a more positive relationship with the community, because they saw it integral to the health and well-being of their own students, faculty, and staff as a key part of evolving themselves as a campus. Intentionally, I showed you a big plan, maybe a master plan, one campus plan, but even a building, right? This is boiled down to a single building in Toronto, informing the conversation. This one in Oakland, in the Bay Area, near San Francisco. They were actually talking about how do you design a underpass, a pedestrian connection underneath a highway. So scale is not the issue. It's the questions that you ask. Who's participating? How do you actually bring some intentionality around some of these conversations? This one I love. This was in Niagara Health. But you can see that in midst all of the conversation, she's just waving like it was a hot day and she was using this more as a fan. In this case, this was at George Brown College. They had a lot of fun with it. So different individuals, 5 of the ones that are wearing t-shirts there are Indigenous faculty for the college, and they each put on a t-shirt that had the color. So one of them represented the social domain and the cultural domain, and they were kind of ambassadors for the different ones. And it was really a way of facilitating the conversation, diving deeper and getting into the conversation. So I'd really invite you to just start asking the questions, start having a little bit of fun with it. It's incredible the types of things that you can get out of it. So I'm going to end all of this coming back to maybe my last 3 generations. Here's a photograph of myself maybe a few years ago. But it's not about the last 100 years. Clearly, we have to be thinking about things differently. This is a photograph of my son, or one of my 2 sons. It's about the next 100 years. How are we setting ourselves up to designing the types of environments that are going to increase the opportunity for the next and the next and the next generation to lead healthy lifestyles that really contribute not just to themselves, to the broader community, and to the planet. So here's a link to all of those reports that are published in the Confront Board of Canada's website. They're all available. Anybody can download them and use them. And there's tons of information there. But I'll stop here, stop sharing screen, and just open it up to see if there's any questions or thoughts from anybody.
Great. Thank you so much, Antonio. That's really excellent.
Q&A, I see one posted over there, that maybe I can get some help reading those out loud.
Absolutely. Yes. Again, a reminder for everyone in attendance today, if you do have a question for Antonio, please type it in our Q&A box, which you'll find at the bottom of your screen. Yeah. We have just the question in the Q&A box is just saying hello from David Landry. So just a quick hello for you.
Hello, David.
So while we're waiting for the architects to and attendees to populate the question and answer box there, I do have a quick question myself, actually, and I believe Ashley has one as well. So if you don't mind, Antonio, I'll ask you my question. So throughout your presentation, you talked a lot about the importance of considering health and well-being before a project begins, of course. That's a really important step. So that helps us to understand the various factors that impact individuals and communities. And you also showed through your slides a lot of case studies that you'd done. So I wondered if you could speak specifically about any of the case studies of Centennial College, for instance, about your consultation and research process for those specific case studies and how they impacted the design decisions that the team made.
Yeah, this is a really seminal question. Many of us feel the need and the burden to conduct research on our projects. And we'd love to be able to do that, right? We'd love to be able to say, I designed this, and here's the direct measure and the indicator. Some of the things that we realize is it's really hard for us as architects, as designers, to be able to do that research and to make the proof of the research a burden to the architect. So we needed to develop a process where the burden of proof was on the researcher, not on the designer, right? Where we could de-link to a certain extent the proof of the outcome from the direct projects that people are working on. So the research is intended to say, if you do this, this is the type of outcome that you can expect, without needing to tell the architect, well, you'd better measure the outcome because otherwise you're irresponsible, right? So the way to do that was, well, we needed to develop some case studies where we actually went through the whole process and did measure the outcomes in a positive way. We also use the literature review, and we use other vehicles through which we can bring the evidence and the proof of concepts and the burden of proving those concepts through the research process. But clearly, you know, if everybody on the screen would love to become researchers, that's awesome. But I know most clients don't pay for that after the fact, and you're often off to the next project, and you have very little access to a building or a park or a neighborhood the years that follow. So we need to understand that as a profession, we're really good at some pieces, and we need to onboard and participate and collaborate with other individuals, in our case, the Conference Board of Canada and many others, who they're really good at doing their piece, bringing some of that research into the equation.
Great. Okay, I see we have a question in the Q&A box here. So Khaled has asked, what's your take on creating small clusters within large subdivisions to bring the neighbors closer socially?
Yeah, so I often feel that many of our projects would be improved if we put them in the blender, like just created a little bit of a finer grain of things. So absolutely, one project we did, it was a big master planned community, and we ended up actually thinking about every single block and the mix in every single block, and how can we create a huge diversity within every single block. So I'm a big fan of fine grain, of getting things really thought about in a scale that is much more conducive, frankly, to the scale of everyday life. Is, you know, the types of things that you can do when you're walking. If I can't get to the park by walking, it's way less likely that the neighborhood park will be successful, because if I'm jumping into my car, by then I'm off somewhere completely different. So fine grain, and kind of the word that was used in the question was clusters, but really thinking about the completeness of small spaces can have a huge impact on them actually being used. And not just in a single way, but actually how each one of those spaces can actually unfold a whole variety of different uses. How is it in the morning? How is it at noon? How is it on the weekday? How is it on the weekend? So the more that more activities and uses can be create a critical mass of users to inhabit those, the greater their success.
Hi, question for me. You did mention cities who measure health indicators very early on in your presentation.
Yes.
So I wanted to ask, do you think more cities should adopt that, and why?
Absolutely. And I've ended up making this presentation to several cities in Canada, and many of them are using it in different capacities. Region of Peel in Ontario is now starting to ask of every development that comes into the city that they submit as part of their submission package a statement around how they are contributing to health and well-being. And this is great. It's still not a enforceable piece, but that's where they're leading towards. They're leading increasingly towards those environments where it actually can become a bit of a requirement. So I definitely see it bubbling up in many municipalities. And frankly, this is where it's had the biggest impact, because we've usually deferred to either the federal level to tackle public health or the provincial level to tackle healthcare. But the municipalities have had a hard time wrapping their fingers around what they can do. And in my mind, there's tons they can do. Like, all of this thing is more at the scale of the municipality. So it's been very inspiring to see how many municipalities are quickly changing, and they see themselves as having a very direct role around this. Much of it actually came out of 5 years ago during the pandemic, when all of a sudden municipalities started to see that they could have an impact on mental health, on social networks, on the way in which people lead their lives. And it's been very interesting, but it is still scattered. It's a little bit all over the place, and it's hit and miss around who does it and who are the political leaders within a municipality. I think it does behoove our profession to inform that conversation, to help advance it, to bring some capacity around it. Again, we don't have any answers here. What we have is an increasingly set of intelligent questions to bring into the conversation, right? And an ability to inform that conversation. But what does, you know, Timmins do versus Peterborough do versus Hamilton do is going to be very, very different. The Vancouver people in the audience are wondering why I used only Ontario examples. Well, that's because the OAA webinar has mostly Ontario people.
Okay, great. So we have another question from Khaled. First of all, they say, great presentation, thanks. And then the question is, what about sustainable energy production within communities? Can that be one of the pillars?
Yeah, so you saw that one of the indicators was, of course, the health of natural systems, right? And the impact that it has on the health of the environment. So energy production is often in many of our typical conversations about reducing or increasing the use of renewables, right? Using an energy source that is able to have a lesser impact on the environment. I would suggest that before we get there, we need to talk about how do we actually decrease the use of energy altogether, right? How do we create environments that are less dependent on energy? And then, of course, if we are going to be using energy, where is it coming from? The smaller, and back to the conversation around small is beautiful in many instances, is we need to be thinking about not just net zero energy on some of our projects and sites and communities. We need to be thinking about net zero water, net zero waste, net zero and kind of closed loop accounting for many of the burden that we may start to place on the ecosystem services that we depend on. Because we know that if our lifestyle has a huge impact now on the environment, whether it's because of the minerals that we're extracting or because of the water that we're consuming or the erosion of ecosystems, we're going to pay for it in the long run. So energy is a huge part of it, but so are the other elements of an ecology.
If there's any other questions, please do type them in the Q&A box.
And I'm looking at the room here as well, which is off screen.
I was thinking, Antonio, just as you were speaking also about, there's a whole new conversation around data centers and e-waste and how this is impacting those in proximity to those sort of institutions as well. So I think that's another big conversation around.
Yeah, and data centers is a fascinating one in my mind in many regards, right? Because the worst case scenario is where we're always thinking about these things in isolation, right? So now we're building data centers and areas that consume vast amounts of energy and water, and it just becomes a hog of resources. But in some instances, we're starting to think about data centers as part of a whole network of environments. So, you know, the adaptation of underutilized underground parking in the inner cities to bring data centers in a way that actually sequesters the heat generated by that to heat the building. Okay, now it starts to get really, really interesting, right? Where we start to recycle what is the waste for somebody and it becomes a resource for another. That VCC project that I put on the screen, earlier in the process, they were starting to dig a hole in the ground and they discovered that the site was on top of the main sewer trunk for the city. And where the structural engineers were going, oh my God, what are we going to do? The mechanical engineers thought, jackpot, because what they proposed was to wrap a coil around that and steal heat from the sewer system. So all of a sudden, free heat. So if we start to think about some of these typologies, and data centers is of course the next one that we need to start to really wrap our heads around, is how do they actually become part of the larger machinery that is cities? And cities, in my mind, are the most complex machine that we have as a society built. And it's still a little clunky, and we're still trying to figure out how does it actually operate. But bringing some of those elements into that conversation can actually enable very positive outcomes. So data centers, I don't know that we've yet figured out how to integrate them in a positive way. They're still in those early stages, but you can see some positive examples already emerging.
And I think that speaks to the importance of collaboration then across sort of different domains.
Exactly, right. And that integrated type of a process, right? Because if we think about them in not just in isolation, but only one group of people is thinking about this, they'll lose out on the opportunity around how does it start to create an opportunity for somebody else.
Right.
And, if there's waning questions, maybe I'll turn it around in the room and see if people have stories of their own in terms of how they've been able to connect concepts of health, well-being, and the design of the built environment. Because we've all tried to do this in different instances, and I've seen a huge increase of that. But I'd venture to imagine that just on the people on the screen, there's a lot of people wrestling with this in a broader way. And I'd love to see if anything of what I talked about for the last hour, somebody might say, yeah, that's something I could see myself bringing into the next conversation, whether it's with a client, with a municipality, with an approving authority, with a community group.
Yeah, absolutely. You're welcome not just to type questions in the Q&A box, but also share your own stories and comments as well. If anyone has any experience with this. Sometimes it takes a little while to type, so.
Yeah. I'll also note, and maybe as a plug to the OAA, that the amount of programming and curriculum and webinars that OAA has been hosting around concepts of health, I've seen increase significantly over the last couple of decades, right? So clearly there's a lot of interest and attention around this.
Yep.
Jim.
I was just gonna say that what I like about this framework too is that it can be applied to any skill. So I'm working on the with the original land trust on the development of a social housing building that is a tower with a mid-rise that is gonna be for Indigenous peoples, and how we're trying to incorporate like the sense of belonging and create these unique spaces for socialization within the building, using like all the rooftops for different social spaces, like child play, but also like urban gardening and urban agriculture, barbecue, and even like a ceremonial space for just like storytelling. And so the Indigenous people have like different spaces where they can share their stories, and just especially because the way they share their stories and they communicate like their ways of being and their culture is more like oral form.
Yeah.
To have these different spaces within the building is very important. But then also, so that's one scale, but then also thinking about like working on a huge master plan here in Vancouver, like Jericho Lands, where we can also, it's not within the building, but within the community, where we can create these different spaces that we can also create this sense of belonging to the new community that is gonna be developed in that area.
That's awesome. Did you hear okay? The audio work? Okay, awesome. Yeah, and I'm often inspired by finding how people find their own solutions to very similar questions. And I keep on finding that many of us share the same problems, but the solutions always need to be bespoke. And I'll give you one tiny little example. So the complete opposite of what you were speaking about right now, the big master plan. This was a group of interior designers. They were working on doing a renovation of a high-end restaurant. So just the interior space for a restaurant. So they came by and they said, well, we like a lot of the indicators, but the affordability one, there's nothing we can do about, because it's a high-end restaurant. What are we going to do? Think about it. It's often the ones that you think the least about are the least obvious ones. Those are the ones that change your design the most. So they went about and they thought about it, and they came back and they said, we thought about it and there's nothing we can do. It's like, okay, go think about it more. And they, after a couple of these cycles, they came back and eventually they said, you know what? We thought carefully about this, and we discovered that the people who work at the kitchen don't need affordable lifestyles. So they put bike racks in the kitchen so that the people who work there could reduce their need for a car and could have affordable access to transportation. So regardless of anything else, it was fascinating to see how just asking the right questions right at the beginning allows them to change the design. And sometimes the small incremental changes can have a huge impact on people's life. And whether it's a big master plan community, or it can be a tiny little tenant improvement in a space, by engaging and thinking them carefully, you can have an impact. And you're not going to guarantee an outcome. The word that is often used in the discourse is you're going to nudge behaviors, right? You're going to nudge and make the right choice be the easy choice, right? And making the lifestyle that contributes to health and well-being, making that easy and facilitating that for people. Yeah. Any other questions, thoughts coming up?
We've just got something in from Catherine. So they say, my experience with developers has been a focus on value engineering and minimizing spending to maximize profits. How can we incorporate thoughtful design around these pillars without alienating existing clients by going above the bare minimum required by city guidelines?
Yeah. So curiously enough, the one of the groups that I've seen most use this framework has been developers, has been people who you would otherwise think are entirely oriented around the financial outcomes of a project. And the reason is threefold. One is it helps facilitate the conversation with community. They're not trying to design something that doesn't work. They're trying to design something that works. But often when they go into a community meeting, the conversation is acrimonious and it's entirely focused on density and parking and height and these kinds of things. So it allows for some more meaningful conversations. They want to create spaces of socialization. They want to create things that do work, and this allows them to facilitate a conversation with community. Second is it actually enables a lot of their conversations now with the approving authorities, right? Because they can now frame and bring a project that isn't just simply trying to meet the guidelines. They can now demonstrate how it's actually trying to do different things and better. And designing a horrible building and designing a great building doesn't cost necessarily more. You can do some amazing things. The examples I gave don't cost more, but they have a huge positive impact. And then the third piece, they could actually go out to the marketplace and say, this is designed for health and well-being. They can actually demonstrate to the future tenants of a building or the future purchasers that we have designed things for a positive outcome. And whereas the conversation around sustainability often hits a wall, and people who are interested in sustainability are interested and those who are not, I found the adoption of the concept of well-being is much broader and it is much more encompassing and brings more people in. And the epiphany for this was those who will remember Hazel McCallion, the mayor of Mississauga, and she described herself as the development queen. And she was mayor for 33-ish years. Somebody's going to correct me on this. But in any case, there was a moment about 15 years ago where many cities across Canada were declaring themselves, we're going to be the greenest city. And Vancouver was the greenest city, and Toronto was going to be, they were going to be the greenest city. And Hazel came out and said, I want to be the healthiest city. And that's when I realized, okay, if Hazel can buy into the concept of health and well-being, then everybody can, right? And we can create a much more encompassing conversation. And that's what we've discovered with a lot of the development community is they can create extremely financially successful projects that create now a more positive relationship with the community, with the regulating authorities, and actually result in a better project. Builds their legacy, builds their reputation, and it doesn't need to come at a higher cost.
That's a great example of Hazel, I think. That really goes to show.
Oh, yeah. Well, and one of the highlights in my profession, so we engaged a lot. We did actually the whole engagement for the city of Mississauga's vision for the city. We engaged with over 700,000 people. It was a lot of fun. And at the outcome of that, Rick Mercer came by and did a 15-minute interview with Hazel and asked her, so after all of these years as mayor, what would you be doing different? And Hazel responded, I'd build transit. God, if we were able to change Hazel's mind, that was huge, right?
Great. So I'm not seeing any more questions coming in on our side. I don't know if there's anything else on your end. Any questions?
Well, only to mention that all of this is on the Conference Board of Canada's website. A quick Google Community Wellbeing Framework, you'll probably find it directly, but if anybody can't, just send me an email. I think it's probably easily available as well. And I can connect you. We've made all of this available across the board, and I've been getting phone calls from people in Venezuela and Paris and the Arab Emirates who are asking questions like about the application. From our perspective, if people are using it in their own ways and meaningfully improving the well-being of the communities, that's awesome. So really, the more people who can use it, the merrier.
Great. Okay, so I just have a few quick closing announcements before we finish for today. So again, for those who are seeking continuing education hours, a reminder that the OAA will record your participation in this webinar and on your OAA transcript. So there's no need for individual reporting on your part. We just kindly ask that you give us a little time as we go through the process of uploading and those hours. As well, attendees will soon receive, I believe, the presentation file, and the recording will be uploaded to our YouTube page as well. We will also be sending out, excuse me, with the presentation file, a survey for feedback. So we really, both us at the OAA and our presenters really highly value your feedback. So please take a moment to fill that in when you can. And a quick note about our upcoming webinars. We have a webinar next week on Thursday, October 23rd at 11 a.m. And this one is titled Discover Toronto's Eco Roof Incentive Program. And then also be sure to check out our October 30th risk management webinar that's being offered for 50% off for OAA members. And this one is titled Professional Responsibility Under Municipal Renovictions Bylaws. So once again, thank you so much to Antonio. Thank you so much to everyone on the call today, everyone at Antonio's studio as well, for your attendance and your participation, and have a pleasant remainder of your day. Thank you.
Ciao, everyone.